Hello, my name is Odyssey Stapleton, and I am the Chief Diversity and Inclusion Officer at Secours Mercy Health. Today, I'm going to spend a little time sharing with you a bit about our Diversity, Equity, and Inclusion initiative as they relate to the We Are Called pledge that we have committed to with the Catholic Health Association. Throughout this video, you will hear from a few of our Bon Secours Mercy Health leaders at the system level to share some of the work that we're doing in support of the We Are Called pledge. You will hear from Dr. Wael Haidar around the work that we're doing to ensure that we are putting our house in order. You will hear from Wyan Johnson, System Director, Diversity and Inclusion, who will share some of the work that we're doing to build just and right relationships in the communities we serve. And you will also hear from Jill Jansen, Director, Advocacy and External Relations, who will share with us some of the great work that's being done at Bon Secours Mercy Health to ensure that the policies that our legislators work on in support of the work that we do assists in fulfilling the pledge and addressing systemic racism in the communities that we serve. Here to speak to us about some of the clinical aspects of putting our house in order is Dr. Wael Haidar, Chief Clinical Officer at Bon Secours Mercy Health. Please share with us some of the work that we are doing on the clinical side to eliminate disparities, some of the measures that we have in place around health equity, and what we are actually doing to retain, train, and keep great talent and ensure that our house is in order.
A lot of this work started is ongoing work, but during the pandemic, we noticed that there's definitely a gap when it came to vaccination, access to care, and we had dedicated initiatives around empowering and making sure that we are communicating to minorities, making sure that we are vaccinating those communities. And so with the pandemic being over, we decided to keep working on what else is out there and how can we make sure that we are bridging the gap.
So talk to us a little bit about some of the measures that we are actually maintaining and obtaining so that we can follow up and ensure that we are moving the needle in the long run.
The big priority for us is sepsis mortality for this year. When we look at the other metrics, all the traditional primary care metrics, the ambulatory metrics, now we're starting to report them by race. So whether you're talking about your colonoscopy rate, your mammography rate, your blood pressure control, A1C, all of these metrics, they're the same metrics for everyone, but now reporting them by race and ethnicity will allow you to see where we have gaps. In some places, it's not easy to drive the change because if that number is low. And so that's usually, but when we have concentration of patients, that's where we see the biggest movement of the needle, because that, it's not a one-off or somebody that is one individual that could skew the data, but it's pretty solid from a statistical perspective. And just the visibility of the data itself is the first step to make sure people understand and see that there's, differences that in their practices. In some cases, there are differences in clinical protocols that are needed, and that's what we're working on right now.
Do you have any closing comments or thoughts around the work that we're doing here on our We Are Called pledge to ensure that we are assisting in eliminating disparities, particularly making sure that there are no underlying aspects of racism in the work that we do here at Bon Secours Mercy Health?
I do think that this is a very, very complicated problem to solve, and I think that we remain focused on trying to do what we can and focusing on smaller steps because we can easily get lost in the immensity of the problem that is ahead of us.
I'm happy to introduce today Jill Jansen, Director of Advocacy and External Relations, to talk to you about what it is that we do at Bon Secours Mercy Health to advocate in these areas. When you're working directly with some of our legislative representatives in DC and elsewhere, I know that there are a few examples in particular that are near and dear to our hearts where we've really been pushing advocacy even recently.
So we do work with the Health Anchor Network and advocate for policies around workforce shortages, around educating our workforce, and around housing policies and affordable housing. We advocate for tax credits in this area. We also do a lot of work on the human trafficking front. So we have a team who have been focused on forensic nursing, for instance, for quite some time, who are addressing all forms of abuse that we see in the hospitals. And we work with politicians to help with policies such as making strangulation a felony, because we know the importance of strangulation leading to worse outcomes. And we also have increased the reimbursement rates for sexual assault exams, allowed court testimony via video for sexual assault cases. So we are working with not only our elected officials, but also our community partners in all of these areas in order to serve the communities that we do.
Do you have any specific examples around investments or places that we may have put up a set dollar amount to ensure that people of color and those in marginalized communities are able to afford a place to live where they are in the communities that we serve?
We have a partnership in Baltimore that provides community housing and affordable housing, and they serve the community not only through housing, but all of the supports that are needed from childcare to employment. So we serve many of our communities in that way, some in different ways than others.
I would like to introduce Wyon Johnson, System Director, Diversity and Inclusion, to share some thoughts around the great work that Bon Secours Mercy Health is doing to ensure that we are addressing racism in the communities we serve. Hello, Wyon.
Hi.
So give me a few specific examples on what we are doing with minority communities so that we can better assist them as we establish relationships.
I think most of the communities are really focused on access to care and have a number of different programs surrounding that. So in our Greenville market in South Carolina, they have a whole community engagement program on how they bring access to the community. That involves engaging with clergy members and ensuring that church members have access to healthcare and know how to get access. It also involves going to barbershops, and people can walk in and get their blood pressure taken and know their numbers because of that particular setup.
Can you tell me a little bit more about that in these communities? I know that people, certainly African Americans and people of color, tend to trust the barbershop location, trust the church location. What are we doing to ensure that when they are there, they have ways to follow up with Bon Secours Mercy Health or any of the providers to ensure that they don't lose that upward trajectory toward becoming healthier?
So a number of communities have resource guides that they have developed that they share. And so in particular, back to Greenville, where someone walks into a barbershop, a beauty shop, they have their blood pressure taken, and they realize, oh, there's a concern that I should look into. This community resource guide is available to them then to determine, are there physicians that they should be going to? But also it addresses other resources they may need around food, housing, and who to contact for other things that they could be experiencing in their life.
In closing, is there anything in particular or anything that you'd like to ensure that we highlight in the work that Bon Secours Mercy Health is doing to make certain that we are establishing and maintaining just and right relationships in our communities to address the concerns and assist in ending any perceived systemic racism in the communities we serve.
I think we're on the right track. And I think the main thing really is we have to continue the focus. I think the structure we have with our leadership councils for diversity and inclusion, involving in those our community health departments, or the community health department as part of the LCDIs that we have, I think really allows us to focus where the need is and understand, what are those things that we can do. And it's not a system initiative where we're saying we have to go and do these things. They're really understanding the needs of that particular community. As long as we continue that structure and really focusing and reviewing what those needs are, I think we'll continue to be successful. I'm excited about where we're going to go. And as we continue to come up with new initiatives, I think it'll be exciting for us to see the outcomes that we're trying to drive towards.